Good evening, everyone. We are so excited and delighted that you have picked up and joined us tonight in this marvelous forum, our town hall, to gather to talk about where we are now with COVID-19 and how we're getting along with this and how we're going to move forward with this disease and virus that has attacked and invading our city and our world. Tonight's going to be exciting. It's going to be a time for learning. It's going to be a time for asking questions. Prayerfully, it's going to be a time of relief when some of you will find some of the burden lifted off of your shoulders because you'll have better information to work with. This is all about good information. Really, it's not about how we got in this position, how somebody did this or that. It's about how we're going to navigate, how we're going to get through, how we're going to make it. And we are going to make it. We are, each and every one of you is going to make it. We believe that. And that's why we're here tonight, because we want to give you one more tool to make it with. Tonight, Dr. Jackie Fulton is going to be guiding us as our moderator. Jackie's been a member of New Psalmist for forever, and we've been friends for longer than that. We were friends in high school. And so I'm just so delighted that she's going to introduce the panelists in a moment and begin to start sharing with where we are now with this virus. So let's bow for a moment in prayer, because I want to ask God to be with us. Father, in Jesus' name, guide us now and direct us. Open up the minds and hearts of those that share with us, that they might receive proper and good information. We want everybody to be blessed by this tonight, God. So make it happen, we pray. In Jesus' name, amen. Dr. Jackie Fulton, in your hands.
It is my pleasure to moderate. At the close of this town hall, it is our hope that you will have a sense of how all of us as a community can come together to handle this pandemic. Globally, over 700,000 people have lost their lives to this virus. In the United States, that's one of every four deaths in the world have occurred in the United States. As of this morning, we've had 157,000 Americans lose their life to COVID. Since April the 15th tax day, we've lost almost 124,000 Americans from this virus. It is imperative that we do not overreact, but we stay updated with accurate information, and that's what we want to try to do tonight. This disease, as you know, doesn't respect anyone. It has no respect for political party, race, or gender. People of all ages have gotten ill with this virus. So tonight, Bishop Thomas has seen fit to bring us together as a medical panel to provide updated information. And our panelists include Dr. David Marcosi, we'll be calling him Dr. Marco, can you wave? Dr. Letitia Duraza, who is Baltimore City Health Commissioner, and she's only going to be with us for half an hour tonight. And then Dr. Jonathan Shepard. I'm going to have each of them briefly introduce themselves and what they do on a daily basis. Dr. Marco?
Thanks, Dr. Fulton. I'm an emergency physician at the University of Maryland Medical Center. I'm also the systems for all 13 hospitals incident commander for the University of Maryland Medical System. And I'm also serving on the governor's task force for the response and recovery for Governor Hogan. So I look forward to the conversation today. And Bishop Thomas, thank you for your leadership in this effort.
Dr. D.
Awesome. Thank you, Bishop Thomas. Thank you, Dr. Fulton, for the invitation. I am the first African-American female health commissioner for Baltimore City. And in my role, we have been responsible for leading the city's response to COVID-19. So that includes our work around minimizing spread of COVID-19, especially as it relates to the vulnerable population. We provide support to our more vulnerable populations, including meal and food delivery, as well as mobile testing efforts. We coordinate with our local healthcare partners to support medical surge planning. And we've also been supporting the city's overall recovery strategies as they begin to bring services back online. Thank you.
Dr. Shepard.
Good evening, everyone. Jonathan Shepard here. I'm a board certified child, adolescent, and adult psychiatrist, chief medical director for Hope Health Systems, which is a large mental health organization based in Woodlawn, Maryland. I am also the board president of the Black Mental Health Alliance, which is a non-for-profit organization that, again, is based here in the DMV area. I will say by ministry, I am an elder too in the Church of God in Christ, a member of Carter Memorial Church of God in Christ, where my fine pastor is Bishop Carl Anthony Pierce Sr. And so needed to let you all know that.
Oh yeah, you gotta say that. Dr. Jackie, I forgot to mention that folk can put their questions in the Q&A. Any questions that they have, they should type them right in the Q&A and we'll get them and funnel them right to you.
Okay, our last participant is Bishop Walter Scott Thomas of New Psalmist Baptist Church. I'm sure you'll have some questions.
Yes, I'm a certified quack and I'm on tonight to give all quack information. For anyone who needs quackery, I have the definitive word.
He's actually quite knowledgeable. We all know that. So get your pencils, papers, or mobile notepads, and let's get started. I'm going to go and see what's in the chat room. Okay. Just a little bit of technical difficulty here. Hold on for a second. Okay, our first question. Will the virus affect the flu shot? Will we have to get 2 shots, one for the vaccine when it becomes available and one for the flu shot? Dr. D?
Hi, Dr. Fulton. Thank you. So we are very, very strongly promoting people getting flu shots this year. Certainly, as the health department, we'll be working likely with other partners to ensure that there's access and availability to the flu shot this year, certainly for our vulnerable population, but really for everyone. So they will be 2 separate vaccines. So please, folks, look for opportunities to get your flu shot beginning as early as September.
Dr. Jackie, can you follow up with her? Dr. D, can we follow up? Because I'm meeting a lot of young adults and some older persons who are nervous about taking a vaccine. And especially this one.
Yeah, I completely understand, the nervousness and the anxiety. I mean, certainly I would say, especially this year, and I'm sure Dr. Marco can back me up with what he's seen in the ED and what he sees at Maryland, but especially this year, because the symptoms are so similar. I think to get your flu shot and potentially protect yourself from the flu, as opposed to when you go to the ED, if you're having symptoms, you could have either flu or COVID. It does add that extra layer of protection. So I understand the nervousness. Most folks, that they have no reaction to the actual flu vaccine. So I would heavily recommend it for everyone.
Since Dr. D has to leave us before we're completed, I want to ask her if there's anything she wants to speak to as far as COVID, the status of COVID in Baltimore City.
Yeah, thanks, Dr. Fulton. I don't want to take a ton of time. I do want to urge folks to go to our website, coronavirus.baltimorecity.gov. We actually have a public-facing dashboard that reports daily case counts. And this is data that we receive directly from the state. It has a lot of other useful information, including where we are in terms of our reopening phases. And most folks may know just from reading the paper, watching the news, that we are seeing an upward trend in Baltimore City, specifically among young people. So I'm glad that Bishop Thomas brought up the young adults, because they're not immune. And the concern is that we're seeing an uptick in younger adults. We're seeing higher positivity rates in younger adults. And it's possible that they could bring it back to older family members or older loved ones who are at great risk. So if I had to encourage folks to do something, I would say, please avoid large gatherings. Please socially distance while you're out. There is a health order and a governor's order now that requires folks to wear masks when they're in public spaces. So please do that in addition to your social distancing. But again, avoid the large crowds, avoid the large gatherings.
There's a website called Charm Care. Is that still up?
Yes, ma'am. So charmcare.org is still available. And this does provide a list of resources. Some of them are COVID specific, but some of them are just general resources like access to food pantries or access to mental health resources and support.
Okay. And there are a couple of questions about testing I think would be appropriate for you. Looks like a couple of them have to do with the wait time. One person wants to know, when will the general public be able to get instant testing that the White House gets? And somebody else wants to know, why is it that the NBA players can get their test back in a day and it takes us 10 days now?
That's a good question. Both of those are good questions. So rapid testing is available. It's available now, and it's available at some of the CVS sites. So, the city-supported testing sites, we don't necessarily do the rapid testing yet, though it's something that we're certainly thinking about. But there is some rapid testing available. I think at once our MedStar was doing some rapid testing as well at their urgent care. So, we do have rapid testing in the city, and for a list of all of the opportunities for testing, please again check out our website, coronavirus.baltimorecity.gov. The NBA players question, that's a good one. They have resources I think that not all of us have access to. So lots of money tied to NBA players getting back to the courts to be able to play. So they want to be able to test them quickly.
Along the lines of testing, we're looking at going back to school in October in Baltimore City. What's the likelihood we'll have testing for the teachers as well as the students by October?
That's a good question. I think we're still, at least the way that we procure our labs, we use a national vendor usually for most of the tests that we procure, LabCorp. And what we saw, and a few weeks ago, there was a longer kind of turnaround time for resulting, is as there were cases surging across the country, it backed up our availability to get results in a more timely manner. So, I think, I'd like to hope that we will have more access, but a lot of things are going to be happening in the fall. So in addition to public schools going back, we're also going to see our colleges, potentially going back, and that being an additional strain on resources. So I don't have my crystal ball, so I can't predict, but certainly this is something that we're already thinking about and trying to plan for. How do we make sure that we have enough for everybody?
And the last question for right now is about immunizations for back to school. Where are we as far as the city? Are we seeing folks getting their immunizations, or?
Yeah, so we resumed our back to school immunization clinics about 2 weeks ago. So we've done them a little differently this year. Previously, we didn't necessarily require appointments, but obviously this year we've been requiring appointments and ensuring that folks can remain socially distanced. So that's going to be pretty important. As schools are opening up, we do support school health. So we will have school nurses available that can also support immunizations, but certainly for any family who doesn't have a pediatrician or have access to healthcare, they can check out our website again to find out how to be scheduled with our immunization clinics, because we are doing back to school immunizations.
Okay, Dr. Marco. Bishop, did you have a question?
Well, I was going to ask it to Dr. Marco after you, but go right ahead.
Okay, Dr. Marco, we're coming up on cold and flu season. How will you in the emergency room know the difference between COVID, the flu, or just the cold?
Dr. D brings up a very good point, and I think that I just kind of want to emphasize that. As an ER doc, at times, or any physician, at times we can't see the difference by symptoms or signs or how you're presenting, whether or not this is flu or COVID or another common cold type virus that's presenting to us. And that makes this fall a challenge. So to emphasize what Dr. D was speaking to around getting your flu shot, the flu shot does not cause the flu. So that is one key thing. When I'm in the ER, folks will say to me, well, I didn't get my flu shot this year because last year I got my flu shot and right after I got the flu, or I got something that felt like the flu. They were not correlated. You can still potentially have symptoms of the flu when you have a flu shot. It's usually less mild, but the key is to get your flu shot early to make sure that you are trying to lessen the risk of having flu-like symptoms, because flu-like symptoms could be the flu mildly, could be COVID, or could be another cold type symptom. And in the emergency department, in the healthcare system across the nation for Maryland and certainly for Baltimore, we are worried, and we are worried about the challenges we may face in the fall with having to address the strokes and the heart attacks, and then flu on top of that, and then COVID on top of that. So we want to try and keep everyone as healthy as we can moving into the fall.
So Dr. Marco, if I'm feeling like I'm having a heart attack or a stroke, or my asthma is really acting up, should I avoid the emergency rooms?
No, so thank you for that question, Dr. Fulton, because it's a question I get asked often. If you feel as though you're having an emergency, if you feel as though you have those, heart attack, stroke, or any other symptoms that you're concerned about going to an emergency department, every one of the hospitals that I am familiar with in every one of the emergency departments, from Hopkins to Maryland to MedStar, and Dr. D, you may know some of the others, but the bottom line is they have put measures in place in the clinical space, in other words, in hospitals, to make sure that number one, that the patients are protected, that visitors are protected, and that staff are protected, and they're not sharing any potential viruses between them. But to that end, I'll just say, Dr. Fulton, there have been some of the hospitals across our state have put measures in place to limit the potential risk for what's called asymptomatic spreaders. In other words, folks who are carrying the virus who don't even know it. I feel fine, but I'm still transmitting the virus. A couple of those measures. One is that they have restricted visitors. So we actually had a no visitor policy at one point, and we started to open that up a little bit to try and figure out, because visitors consume personal protective equipment and could spread the virus. One. Two, the other thing that we asked that all visitors and even patients who are able to put a mask on is to put a mask on if you come through the doors of a hospital. Putting a mask on doesn't necessarily protect me as much as it protects you from me spreading it to you. And that's a key piece. So we ask all of our hospitals, whoever walk through the door, whether or not you're dietary, a nurse, you're doing computers, you're working on the computers, or you're a visitor or patient, we're asking you to put a mask on.
Dr. Shepard, there's a question here for you.
Jackie, before you move, Dr. Shepard, could I ask Dr. Marco one question? Could I ask Dr. Marco one question,
Sure.
Jackie?
Mm-hmm.
Doc, you met with a group of preachers before all of this began, and you did not sound an alarm. You banged a bell and shouted from the highest mountain that trouble was on the way. Can you tell us your feeling sentiment then and your feeling sentiment about where we are now and what we can expect going forward in a way that can hopefully give us a status of where things are?
Yeah, thanks, Dr. Thomas. I think that when we all spoke with Dr. Suntha that day, with all the religious leaders in Baltimore City, yourself, it's because of leaders like you, leaders like Dr. D in this city that have demonstrated early action to protect congregation, parishioners, our city, and to make sure that we're doing as much as we can, as early as we can, to protect folks so that this virus doesn't spread, number one, and that folks understand what the risk is. Because as we all had that conversation, I think it might have been early February, really before we were really in the throes of this.
The week leading up to the third Sunday in March, my anniversary.
Okay.
The Wednesday before.
There you go. Okay. So, it was early, but I think that what you saw was a community coming together, trying to understand what the risk was, understand its impact to its community, and to take significant actions that you all embraced to figure out what the best go forward was for, the city of Baltimore. And it's really because of leaders like you that we are where we are. And I want to commend both you, Dr. Bishop Thomas, Dr. D, on demonstrating exemplary leadership as we navigate this. But that said, as we all know, this job isn't over. We're entering the fall, and the fall is going to be a challenge for all of us. So we all need to stay vigilant to the actions we took back then.
Just going back, Dr. D, can you give your website addresses again?
Sure. Coronavirus.baltimorecity.gov.
And the other one was
Charmcare.org.
Okay. Okay, now, Dr. Shepherd, Americans are facing the pandemic, economic distress, and may be experiencing racial injustice. Have you been seeing an increase in the number of patients seeking mental health services?
Well, let me say this. That answer is yes. But let me just say, New Psalmist, you are on the cutting edge because so many people are just dealing with the virus and how it affects you physically. But the toll that we are experiencing now and the aftermath of this will be on our emotional well-beings. And some people say we're experiencing parallel pandemics right now. It is the truth. I will say I am not short of any business right now, truthfully. When the pandemic started and when our offices closed with the telehealth sessions in mid-March, I had a no-show rate of 0% until the end of June. It wasn't until July when some of the measures started to ease up and
people could get out.
Yeah, people were at pool parties and house parties. You know, they would answer the phone, but I'm like, I hear all this noise in the background. Like, what is going on here? So it was in July. I know distinctly the cutoff when people started going back out. So to answer your question, yes. I mean, we did see a dip as far as new referrals, but as far as people who were already engaged in services, people were ready. And let me tell you also what was surprising to me. People wanted to stay longer in their sessions. It was very difficult for me to end sessions. 30-minute sessions turned into 45-minute sessions. Hour evaluations turned an hour and a half. And so I had to pace myself because I was starting to feel myself burn out. And so I'll just say this and not say this lightly. We must pray for our doctors. We are operating at a level that we have never operated before. I've talked to so many of my colleagues, and it's just a continuous effort that we're trying to put out. So please, when you pray, please pray for your doctors too.
So there's another question for you, Dr. Shepherd. What is your suggestion for students returning to school and how educators can address the trauma and anxiety around COVID?
Absolutely. So this is what I'm referring to. So in addition to the physical things that we have to be made aware of what COVID-19 can do to the body, to the human body, it also traumatizes the mind. So many of our students, they were unprepared to be at home with their parents. The parents are unprepared for their children to be at home too for that extended amount of time. And so there were children who missed their graduations. There were children who missed certain milestones, events that really affected them. I've talked to several parents whose children, I mean, they're mad to this day that they could not walk the stage for graduation. So that does leave some type of irritability. And I use the word trauma loosely, but there have been children who've been traumatized because they've lost parents, they've lost loved ones to the virus. I know distinctly of a family whose grandmother caught the virus when someone from the home brought it in. The grandmother had never been outside, from what they tell me. And so I had to care for them. So moving now into the school year, we have to allow these children to talk about their experiences, depending on what age group. They can draw, they can journal about their experiences. Children would let you know how they feel. So you just need to listen to them. And then we must be ready to receive them. My concern is, are we going to be ready with everybody already so anxious and overly charged? I don't know if we're going to have time to really listen to what our children are saying. And so that's where I want to, hang my hat on. And if a child is disordered, I'll say this and I'll end. Disordered means that that child is not functioning properly. You know when your child's not functioning properly. They're not able to sleep, they're not able to eat. Their hygiene changes. They may even start bedwetting. They may even start doing other things that revert back to an age that's much younger than what they physically or even developmentally are. Then that's when you know you need to get that child some help. And it's never too young for your child, for you parents to seek help for your child if you know that they are disordered.
So
Jackie, can I jump in at this point too and ask a question to all three? Because as a pastor, chances are I'm not going to get anybody coming to me for a diagnosis with COVID. That's not going to happen even with my degree in quackery. But what is going to happen is I'm going to encounter persons who are suffering sometimes outwardly and other times inwardly with guilt and grief. That terrible combination. I'm getting parents that are suffering from terrible sense of guilt that they are not providing for their children what that child needs educationally or whatever, and tremendous grief that their yesterday is gone and they had no opportunity to say goodbye. Yeah. No opportunity to bring their yesterday world to closure. And they're grieving all of that while at the same time feeling guilty. What are the resources, and I guess I'm saying phone numbers and clinics or places that you all have that persons can write down tonight if this is getting them where they can go at the hospital, in the city, from psychiatrists and psychologists? Where does one go?
Absolutely. I'll start out. First of all, let me just say it is okay to feel the way in which you feel. People must know that. And again, with me growing up in the church, I even was speaking with a church member today. I have to let her know that what she is feeling is okay. And some people even question their salvation regarding how they're feeling. And so I need to let people know this is not the time to question your salvation. Jesus himself felt certain ways as he went through crises, and we're going through a crisis. And so it's okay that you feel like this. What the thing that we must stress here is that if you're being disordered, it's not okay to stay disordered. It's all right to be distressed, but it's not okay to be disordered. And so some of the numbers where I work at, I'm just going to start there because I believe in what I do. All right. And so, hey,
that's right.
Hope Health Systems, 410-265-8737. Hope Health Systems or .com. We're taking intakes now. You can go online. But again, the city of Baltimore, really the state of Maryland, is fortunate. I come from Illinois, and with some of the resources that we have here in Maryland, they don't have in other states. We have crisis centers for children, Baltimore Crisis Response Teams. We have BCRI, Baltimore City Response Intervention Teams. These people I work with closely. You can go online. If someone is in danger, national suicide hotlines. And again, people who are within the church, they do deal with suicide. Again, that's taboo language, but I do know what I'm referring to because that is something that actually I'm looking at a number right here for Suicide Prevention Lifeline. That's 1-800-273-TALK. And there is a national movement, and maybe the other two doctors can speak to this. We're looking to hopefully get a hotline where there's a 3-digit number that if you are suicidal that you can call. I'm not sure how far along we are in doing so, but these are just some of the numbers that you can call if you are in need of immediate help.
Dr.
I would
D?
just add that the number for the Baltimore City Crisis Response Line, and it's 24/7, is 410-433-5175.
Dr. D, Dr. Shepard, one of the questions that parents often have, and this may be largely dependent upon race and what we've had to deal with. Many parents are nervous that a phone call will land them in DSS or Child Protective Services, or make them look like a bad parent, or have their child removed from the home, when really all they're trying to do is be a good parent.
Absolutely. Yeah, that is a falsehood. That's a myth. And even if DSS or CPS was called to your home, they're there to do an investigation. They're not there to take your child away. Again, I work with these agencies on a daily basis. We have to move beyond the stigma that is really resting on our communities. That's one of the reasons why I'm so passionate about mental health services. When I went to medical school, I didn't think I was going to become a psychiatrist. But when I realized the need that is amongst people of color, and to help break up and bust up these myths about mental health. Mental health is throughout all of our families. It's even in the Bible. I mean, it's throughout. You know, we all got some issues, truthfully, but it's how you handle those issues. So no one is coming to take your child away. Actually, they will probably rather you call to get the help than not call.
Dr. Marco?
Thanks, Bishop. We have as part of the University of Maryland medical system, and if you had any question on, you know, whether or not you can go back to school, or whether or not these are the symptoms consistent with COVID, or whether or not you're concerned about, one of the questions I often get is, you know, how do I treat my laundry? How do I mitigate? How do I lessen my concern of my laundry being a potential risk? So some of those questions, we have a 1-800 number that gets you right to a nurse hotline. It's 24/7. I know that the Baltimore City has some great resources too, but our number is 888-713-0711. And that gets you our nurse triage line, and they'll be able to direct you to, they may even direct you to Baltimore City. We're working in partnership with a lot of different resources across in the city and the state to get you what you need and also answer your questions clinically.
Okay.
And just to speak for where I work, community health centers often have mental health resources within them. So I think that if you have a concern, if you're not actually already linked into mental health services, you may want to approach your primary care provider to see where they would refer you also. Can I move to some issues? I'm going to ask, anybody can answer these, but can we sing in school? Is it risky to have a job driving as an Uber? Is it safe to travel? So all those are sort of the same.
If I want to go on vacation.
So, Dr. D, you want to go first? Can we sing in school, and can I become an Uber driver?
So, I mean, I think certainly there have been studies indicating that particularly activities like singing, loud singing can cause spread. I think the thing that I tell people is honestly, at this point, with such widespread community transmission, there's risk associated with a lot of activities that are outside of your home, right? So, you know, there's risk associated every time you leave your home. So what I really urge and encourage people to do are certainly look for the lower risk activities. So you don't necessarily, you know, want to be indoors in close settings and close proximities. You don't necessarily want to go to the large mass gatherings, but being outdoors is going to be better. Smaller groups of individuals are going to be better. You know, those are the things. Keeping your 6 feet of distance, wearing your mask and your face covering every time you go out, and there's even an opportunity or potential that you might come in close contact with someone. So, I mean, I think that we all, anytime we're leaving the house, honestly, you know, we're there's some level of risk to just stepping outside and potentially coming in contact with individuals that aren't in your household, that may be, you know, as Dr. Marco mentioned, asymptomatic spreaders. Maybe they aren't actively coughing. They may not have a fever when you come across them, but they could certainly have COVID and potentially spread it if you aren't doing some of those personal protective behaviors, some of those things that we can all take responsibility for on our own to do anytime we go out. I do have to run, but actually I did want to address one of the questions, because this is a question we get a lot in the health department around, I think it was returning to work. Do I need to be retested? And I want to address it specifically because there's been kind of a shift in guidance. And so we take our direction from the CDC. And the CDC did recently release information around when you can kind of be around other individuals again. And so, I would hate to think that people are limited or unable to return to work, maybe because they're waiting on a test that then takes multiple days for the result to come in. And, would hate for that to be a risk to someone's job and their livelihood. So the CDC's guidance now is that from the onset of symptoms, after you've started to have symptoms, at least 10 days since your symptoms have first appeared, and you've got at least 24 hours without a fever, not taking Tylenol or Motrin or some other fever-reducing medication, and your symptoms have improved, right? So this is symptom-based return to work. It's not necessarily a testing-based strategy. So again, I would urge employers, I would urge employees to say this is how you can safely return to work, and it doesn't require you to be retested.
Dr. D, just before you run out, can I just pick up on that when we go just the opposite direction? When you think about children and schools, as you're thinking about, as Jackie asked about singing, do you see the tools being in place in our various school systems to be able to facilitate children coming back to school?
I think it's challenging. Our systems are already so underfunded to provide for some of the most basic needs when you think about the current city school infrastructure. I think that they're certainly working hard to develop a plan that protects everyone. And they're thinking through things like, for example, cohorting, right? So keeping the same group of individuals together. And we've seen this done at daycares and in other settings as well, congregate living settings, where you try to keep the same group of individuals together so that there isn't a lot of cross exposure. And so there are certainly risk mitigation strategies you can put in place. You can, figure out the plexiglass. You can, have students wear masks full time. So I definitely think our schools are attempting to develop a plan, but again, there's risk with community transmission, and you want to pay attention and be aware of what's happening in your community, right? What is the community transmission? What is the positivity rate in your area as you think about returning to school? What's the incidence rate as well in your area as you think about bringing people back to school?
Dr. D, I just want to thank you for your time.
Thank you, guys.
And appreciate you being able to participate.
Absolutely.
We're giving you the great clap, Dr. D.
Thank you, guys. Have a good night.
Thank you.
Thank you. Mm-hmm.
Oh, Dr. David, it all falls on your shoulders now.
That's all. I'm tag teaming with Dr. Shepard and Dr. Fulton, so I'm good, Bishop.
All right.
Okay. Dr. Markham, if someone is asymptomatic, how long does that person remain susceptible to infecting somebody else?
Yeah, that's a $1 million question right there. Whoever asked that is a wise person, because the science is unfolding on this. So we originally thought that, and another question that builds on top of this: are you asymptomatic for the entire time, meaning I have no symptoms, or are you pre-symptomatic? In other words, you're going to get sick, but right now you're feeling no effects of that. And it's kind of like a curve. If you're going to you get exposed, you get the virus, you get more virus, and then you can spread it. Then you become sick, and then you recover from that. So that curve is what we're trying to better define. And science is kind of building that. The way we are thinking about it is this: if you are exposed to the virus today, about 5 to 7 days later, you could potentially test positive for the virus. So if you could be carrying the virus on day 3 and potentially test negative, or not be feeling any symptoms. And after that, on day 5, day 7, remember, there's no hard and fast date that all of a sudden you turn positive. So the science we need to all appreciate is unfolding as we better understand this virus's dynamics and how it affects people. But you could potentially be asymptomatic, never know that you had this virus, and potentially could have shed this virus. And that is a concern, particularly for children. The children may not become very ill from this virus, but some do. Just so you know, just to be clear, any child who any one of us, but particularly children, if you become ill, I have a sense, it's palpable to your heart when a child becomes ill. So children are still at risk for this. Low risk does not mean no risk. So we need to appreciate that. Number one, their physical health and their mental health with regard to this, to the response to this. But you could be shedding the virus, never have known about it, never have, and then all of a sudden realize you were positive just because of you got a test and say, geez, I didn't even feel like I needed anything. I didn't even know I felt or I had the virus. And that's the challenge with this.
Can I follow up on that, Jackie?
Sure.
Doctor, the term asymptomatic, and you introduced the one to us now, pre-symptomatic. I mean, we're getting a new vocabulary with this disease. Most of us have never used that term. I mean, on the regular. We may have heard asymptomatic, but it's not a term we use regularly. When we think about the flu that comes around every year and other viruses, or even pneumonia, are there persons with those diseases who are also asymptomatic, but because those diseases have not had the notoriety of this, we don't talk about that? Are there people every year with the flu who are asymptomatic?
Yeah, you can have different degrees of severity of the flu, right? You can have somebody get knocked down for a couple of days, you feel horribly, you can have a mild kind of chills. I remember a story about someone early on with COVID, and she said she tested positive. And do you know what her only symptom was? Her only symptom was while she was at work, she felt like she needed a sweater on that day. That was her only symptom. So she didn't even feel like she had any symptoms. So you could have flu, mild or severe, COVID, mild or severe, and it all depends upon, which is something I hope Dr. Fulton, you speak to, is some vulnerabilities that some of us have with regard to who this virus affects more severely. And Bishop Thomas, Dr. Fulton, if you just give me latitude.
Go right ahead. Go right ahead.
30 seconds. So as we get older, we are more at risk. Number one. Number two.
Can you say why? Can you say why? Why we're more at risk?
That's a great question. I don't know of the scientific, the scientific answer right now. It is what the data demonstrates, and I can only translate. We've been in this fight for only a few months to understand how this virus moves. So, but we do know that the data that came out of China and the data in the US is fairly consistent. If you're older, you're more at risk. If you are obese, you are more at risk. If you have heart disease or lung disease, or you are immunosuppressed from getting treatment from cancer or other immunosuppressive issues, then you are also at risk. So all of those people who have lung, heart, obesity, all of those, diabetes being another one, you need to be exceptionally careful to make sure that you don't contract this virus.
I'm walking down the street and Jimmy Johns walked past me and he has the virus and he doesn't have a mask and he coughs. Is there a difference between, or will I probably catch the virus from somebody just coughing or from being in a confined space with somebody over a protracted period of time? Is there an amount of virus that that is the issue, or is it just being near a cell of the virus?
Okay, first, in this response, we are our brother's keeper. I am responsible for you, Bishop Thomas, and you are responsible for my health. If I am wearing a mask, I am stopping my spread of this virus to you. So truthfully, we are responsible for this other in this fight against this virus. That's number one. Number two, I don't like the concept of social distancing because, and I won't speak for Dr. Shepard, but we need to be more now more than ever socially connected. But we need to be physically apart. And because this virus can spread from talking, from singing, from coughing, from sneezing. So socially distance helps, wearing a mask helps more. Wearing a mask and being socially distanced helps even more. So if I am trying to lower my risk for contracting this virus, I want every piece of that entire strategy layered in front of me so that virus can't get to me and I can't spread it to somebody else in my family, in my community, to my clergyman, anyone at all. So that is what we need. So we need to focus on with regard to as we move into the fall.
So Dr. Marco, we're going to come back and talk about vaccines in a second, but Dr. Shepherd, there are questions, I think we can combine this one. What is your suggestion for students returning to school with trauma and anxiety, and how can educators address it, particularly with Black students? And along the same lines, how can we get high school and college kids to wear a mask? Okay, they don't think the virus affects them. Dr. Shepherd. Yes. So how can educators help the students when they come back with the trauma and anxiety? And are there any techniques to helping high school and college students in the effort to get them to wear a mask?
Yeah, absolutely. I'm going to take that last part B. I'm going to leave for, yeah.
That's a mental health issue.
That's a behavioral issue, which is
there you go. Isn't that what you do?
Which is not always mental health. That too, yeah. So that's a whole other talk right there. But in regards to the teachers and educators, this is your time now to become well versed about what techniques that you can learn. One of the things, again, I talked about making sure that you provide resources for your children to be able to speak, talk. Listening to a child, that's one of major ways in which I'm even able to work with children with mental health. We have to be able to listen to what they're saying. We have to provide consistency. In the midst of crisis, consistency and structure is needed. It may sound so simple, but it is absolutely needed. So having some type of consistency and regimen in which you conduct your class so that the child knows what to expect when he or she gets there. So that is a great way. Music is always a great way. And then you also have to demonstrate for yourself. And I know for educators, this can be difficult. If parents can be difficult, but you must be able to model what you want children to do. Children will model the behaviors that are being taught to them. And so in this pandemic, which is very difficult, I can even hear some people now, say, I don't know how I can do that. But that is one of the best ways in which we can work with our children. So what I'm saying, modeling, model reassurance to them, model confidence to them. And I know you might be saying, well, I don't feel confident. I'm anxious. I'm this, I'm that. And I don't want to tell you that you got to be an actor or fake it. But that's why we want to make sure that parents are getting the resources and reassurance that they need themselves. One of the major things that I deal with when I work with children who have anxiety disorders, and anxiety disorder is the most common disorder, psychiatric disorder in our country. And what I tell parents is that most times children who have anxiety disorders, they're modeling what they've seen through their parents. And so that's not always the case, but the majority of the case, I find out the parents. And so I also have an anxiety disorder or anxiety issue. And so that's one of the things that we work together with. So educators, hopefully you're able to hear some of those techniques that I was able to present in this particular forum. Even breathing exercises, taking some time out to allow your children to, in the classroom, to kind of settle themselves. How you begin the day and how you start off that day is so important. So those are just some of the things that I would suggest. Now, to the difficult question about making people wear a mask. Let me just dispel a couple of myths, all right? Wearing a mask is not gonna make you pass out. Okay, wearing a mask will destroy your brain cells. When I was a resident And again, I'm in psychiatry, but again, I went through all the different specialties in order to be able to get my MD. I used to have to sit in surgery, knew I was not going to be a surgeon, had the mind of a surgeon, but I didn't have the hands of a surgeon. I would wear a mask sometimes for 8-10 hours and I never passed out. So the mask is not going to make you pass out. All right. So a lot of people say, well, I just don't like the way in which it feels. And I even heard somebody today said, when I wear a mask, I can't hear too well. So that's just psychological. That's all that. So I think Dr. Marco said it. Wearing a mask is protecting your fellow person, your peer. You have to believe that and have to know that. When I wear my mask, that means I care about you. I mean, that's literally a demonstration of what that wearing that mask means. So model behavior again, for that teenager, and you get it, wear your mask, with your boys, wear your mask with your girls, say, how come you're not wearing a mask? You have to be able to stand up and let people know. When people come into my office, and I'm in right here, Dr. Fulton, hey, I know we work in an office. I need you to put your mask on, otherwise we can't talk. Mm-hmm. And so just kind of setting that standard. So you have to be someone who's not afraid to speak up. All right. This is not the time to be afraid.
Jackie, if I could add on that, parents have to remember that they are parents and that this is not the season to be co-signing non-consequential behavior. This is the season to really stress that actions have consequences. Mm-hmm. And that there are consequences to the behavior. You don't want to wear a mask, you can't drive my car. I mean, I know that we've gotten a long way from trying to put restraints on folks. But if we don't restrain in this environment, we may not retain many of the people that we want to love.
Dr. Shepherd, another question. If you have already been diagnosed with an anxiety disorder or any other mental illness that you have been receiving counseling and medication for, how can you continue to receive therapy when many medical offices have such limited appointments?
Yeah, I'll say this.
Televisits.
Yeah, telehealth sessions. Actually, telehealth has been booming in psychiatry. That's probably one of the specialties where it has really excelled, and we've been pushing for years, truthfully, because we knew that we'll be able to do our work and do it well. Just as a psychiatrist, it just concerns because I like to actually be able to physically see, especially children, make sure the vital signs are good. I always measure weight and height. I'm just not able to do some of those, take some of those vital signs measurements right now. But as far as having talk therapy, individual sessions, that has been working out well. Actually, we've seen a very good, stable rate and even an increase in some of the productivity of our clinicians. So if that person is struggling to find a location, come on over to Hope Health Systems. Again,
tell it, doctor. Tell it.
We're busy, but we got room for you.
Listen, remember, Jackie, we heard that Total Health told us the same thing. Total Health said, listen, you don't have a general doctor? Come on over here.
I do see some other questions about supporting students mentally in school, but I think, Bishop, maybe we can punt those to the education sessions that you're having. So
can I drop one, Jackie, to ask myth, fact, or conjecture to especially to Dr. Marco? Dr. Marco, my wife and I are sheltered in place. We've been in the house forever, seems like. And we have some of those concerns. We are not in our 20s anymore. I don't know when it left, but we're not there now. And so packages come to our house. Sometimes we leave them in the mailbox 2 or 3 days. My wife was and still is the queen of Clorox wipes. We have wiped down mail, newspapers, everything that has come through the front door. Can you tell us what we need to be doing in that area? Because there are persons on this who are tonight who are still wiping down everything that comes in the house, even the food from Burger King. What do we need to do there?
Yeah, so this is about, let's talk about risk. The highest risk that we have and the way this virus likes to spread is, these are bad. Indoors. This virus loves to be indoors. Number two, this virus loves us to be close together. Number three, this virus loves to work silently and not have symptoms. So it's between people who don't have any symptoms at all, transmitting it to others who don't have symptoms. So it operates in the shadows. Number four, so this virus loves when people sing. This virus loves when people talk, sneeze, and cough, because it transmits. If you have all of those, that's why those are all bad. So the more we take those things away, the better. So if I don't have a mask on and I cough into my hand and then shake your hand, and we go from our hands to our face often throughout the day, there is a risk that you will transmit this virus. So it lives on our hands. That's why there is this emphasis on washing our hands, and not washing our hands. You know, I said, Bishop, that day that I think when I was speaking in that church, my 5-year-old corrected me, Dr. Shepard. You'll find this comical, because I went in, started washing my hands. I came home and he was like, hey, Dad, that's not the ABCs, because the ABCs takes 20 seconds about to say, depending upon, my 5-year-old a little longer, but okay. So then I went back to the sink, washed my hands for the entire ABCs, because washing our hands, I was educated by my 5-year-old on what I should do for this response. So to that end, lessening your risk is important. Does this virus live on high touch areas? Yes. For how long? They're high touch areas, right? I'm going to define a couple. In your home, it's different. Could be different, but I'll just toilets, sinks, countertops, the telephone, the remote, your phone, your whatever mobile phone, the handrail, the doorknob. All of those and more are potential areas where I just coughed, touched the doorknob. 20 minutes later, you touched the doorknob, didn't know I just walked through it, and you have the potential to pick this virus up. Now, how long is that? There were some studies that it could be a really long time being, hours to days. We think, again, what science is evolving on this, but it's 12 hours, 6 hours, depending upon the surface. It's less on paper than it is on metal. A lot of different variables there, but the bottom line is it's a risk. And if it is a risk, then you need to continue to use your Clorox wipes. And truth is, you don't really need Clorox wipes. Bishop, I'm going to come to your house because I can't find Clorox wipes anywhere.
Child, I'm married to the lady who can find everything.
So you need just a cleaner, any type of cleaner. Wash it down, wash those high contact areas. If your child comes home from school, changing, I've heard a lot of questions. If I am a hospital employee, should I get out of my clothes, throw them into the wash? Yes, get out of your clothes. When I come out of the hospital, I change in my garage, and I get out of my shoes, walk in, throw my stuff into the washer and wash my hands. So my wife doesn't need to touch it, or anyone needs to touch it, and I put the washer on. So that means that if you have someone in your house who was positive, you need to recognize that how you treat that person in your house. So you want to support them. They need to wear a mask. You need to wear a mask, but washing their clothes, washing their linen, keeping their plate, washing your hands after you care for them are all important things to make sure you don't contract the virus. Dr. Shepard, did I miss anything? I just want to make sure that from your perspective, I was good on that because I covered a lot of ground.
I have a question. Excellent. I have a question for you, Dr. Marco, along those lines. Can you explain the difference between isolation and quarantine? Dr. Marco.
Yeah, so for all intents and purposes, if you're positive, you are quarantining. If you are, I'm sorry, I think it's if you are positive, you're isolating. If you're not positive being positive for COVID, you're quarantining. But the truth is in essence, you're doing the same thing. You are removing yourself from an environment so you are not a risk to other people and them contracting the virus. So you're removing yourself, whether or not you call it isolation or quarantine, from your home, from your community, from your church, so that you're not spreading the virus. Isolation and quarantine, fairly similar in diagnosis. Whether or not one's positive and one's not, you're just demonstrating symptoms.
Are there any mental health services available for the elderly, Dr. Shepherd?
Absolutely. The elderly and our children are our most vulnerable communities. And so there are specific services where I work. We actually have a contract with Baltimore County, and we provide geriatric services. Before the pandemic struck, we actually were sending therapists into the homes. And even some of our psychiatrists were going to the homes of some of those who are age 60 and older who lived in Baltimore County. So I believe 311, you can call the city to ask what those services may be for those who are elderly, but definitely those persons, the elderly and children are the most vulnerable communities. And so we definitely have services that are designed for them. And so please check out those two numbers. Again, Hope Health Systems we provide within Baltimore County. Department of Aging, that's also what I wanted to say. Department of Aging is also a great resource. Also, National Alliance of Mental Illness, NAMI, that many people are aware of. Those two resources are great for providing mental health services for those who are within that elderly population.
Can I pick up on that, Jackie, and ask both doctors this question? Many persons are caring for elderly persons. They got their mother, their dad, or somebody they're caring for, and are using home care providers to help them care for them. Sometimes the home care providers test positive and have to stay home from the job or quarantine and whatever, or isolate, and then come back to work. How should a family receive a home care provider who has been positive? That's number one. What should they look for? Should they just say, "Oh, we'll come right on back"? If they have a senior that's in the home who probably has complications, may even be terminally ill, how should they approach that? And secondly, a kind of deeper question, because schools are about to open, and there are many grandparents on this Zoom on with us tonight. How do grandparents safely see their grandchildren? Let me drop those two.
Dr. Marco, why don't you start first regarding people coming into the home, like a home?
Sure. So first off, the person should not be coming to work, just as Dr. D described, until they have been asymptomatic. You know, that's that CDC guidance. If you're not, so their employer should not clear them for work until their symptoms have resolved for the period of time of which Dr. D described earlier. That's first. Second, so that's a confirmed either symptoms or positive. However, what we need to recognize is that anyone who's entering the home could be positive. That's the problem. Again, this virus is in the shadows. So although it's much easier once we have a defined positive, or I had symptoms and geez, I probably had the virus, but it's the other thing that is, geez, they look perfectly well, come through the home and they're not wearing a mask and they aren't washing their hands. Those are the people who are potentially spreading this virus also. So universally, we should all be using our masks, and we should be saying to someone who's coming into my home to help care for my family members, you need to wear a mask so that you are not they are a risk to you. So you need to encourage them, and not only encourage them, I would say, to Bishop Thomas is, you need to kind of mandate it. You don't come through the door unless you're wearing a mask in my home. And it's not that you are mistrusting, it's just that this virus is sneaky. We want to be careful to not allow it to spread.
Second question, how can grandparents, because many grandparents are really emotionally zapped right now, because you don't get to hug your grandchild, you don't get to hug your children, but you don't get to hug your grandchild, you don't get to see them, you're missing strategic moments in their development. And you're aware that your time upon this earth may not be as long as it has been, or great-grandchildren, and those moments will not be captured by you. How do grandparents, outside of the usual Zoom and chat, is there a way to physically be around your children, your grandchildren?
Yeah, Bishop, this is one of the great questions that we wrestle with. And I'll be honest with you, even as a physician, it's not easy to answer because, I'm missing my own family. I have not been away actually from my parents for this length of time for some many years. And especially during this time where I had a 7-year-old nephew to die back in February, and I had my grandmother to die in December. So we're really still trying to mend. So I hear you. One of the things that can happen is, especially while the weather is still warm, is a public place outside, where there's not going to be a large gathering of people. So have a gathering maybe at the grandparents' home or at the parents' home or a nearby park or something like that, where you all are outside and you can get closer and wear your mask. And there's even a certain way, I can't demonstrate it right now, but there's even a certain way in which you can greet and hug. And I've seen people demonstrate that. So I hear you. One of the physical senses that we have is touch, and touch is powerful. I never underestimate the power of touch. And so not being able to do that really does dampen our emotions. And so those are just some of the things that I would suggest. I don't know if Dr. Marco may have anything else, but that's what I would tell those grandparents.
Yeah, this is palpable. That's a palpable question to me. My mother is in failing health, and I can't see her, and it's very it's challenging. So Bishop Thomas, thanks for asking the question, and there are no easy answers, unfortunately, and this is where you need resilience. This is where you need to be able to connect socially through any means possible. But I know that as a healthcare provider, I'm a risk to my mother, and if she were to contract it, it would be a significant illness. So, but it's, you don't know how long you have left. And if I went to see her, I would be a risk. So I don't have a good answer.
I'd like to.
No, I think it's a great answer. Go ahead, Jackie.
I agree with Dr. Shepard, though. There are ways to be able to at least visually visit. So just coming out and grandparents standing on the step and you're in your car. So there are ways to do that. You can also, as Dr. Shepard said, I have grandkids. You can have lunch in the yard. They bring theirs, you bring yours. You sit 20 feet apart, but at least you're still in the same space with mask on or whatever. So I think it's really important. Now we can also use social media, not the same, but I think it is important for that social connection to occur if you can, if you don't have to travel long distances to see each other. I want to, because
Jackie, can I just add this while you get into the next point?
Sure.
The reason I raised that and a couple of these other questions is because there are no easy fixes for this. There are no quick cut, short, easy ways to live with a deadly virus in our midst. And there comes a point we have to accept that it's here and accept that it's among us and accept that we have to make changes to our behavior. I may not like them, but my faith will help me understand how to manage and maneuver around them and with them. But I won't get there if I'm just angry that they're here, or I'm trying to fight the fact that they're real. This is a real illness that's here. It's real, it's among us. It's, as Doctor said, it's sneaky, it's trying all these ways. And I have to admit that to myself. I wanted to take a trip. I've been trying to take a trip forever, and I can't take it. I had to finally admit that I can't do it. And in doing so, surrender not to the power of the virus, but surrender to the opportunities to continue to live and have a good life. I just wanted to drop that.
That's very important, though. Dr. Marco, there are some questions about using gloves and wipes and that sort of thing, but I really do want you to speak to two drugs. Recently in the news, there was a doctor in Houston with all of her buddies surrounding her, stating that hydroxyquinone can prevent, treat, and cure the virus. So I'd like you to speak to how that medication is being used, if it's being used, and then remdesivir. What is that medication used for? Dr. Marco.
Thanks, Dr. Fulton. So remdesivir is a drug that can be used and has been demonstrated to help individuals who are critically ill. So it is not a pill you take to kind of, when you have mild disease. These are patients in the intensive care unit. And there's some studies that demonstrate that remdesivir has been helpful to mitigate the course of that disease. And therefore there are less mortality as a result of using that drug. It doesn't prevent it all. We still are having obviously a significant amount of deaths in our city, in our nation, in our state. So it is not a cure-all. But there is some evidence that demonstrates that it can be helpful for critical illness in this virus. Not curative, but helpful. On hydroxychloroquine, right now, there is not significant evidence to demonstrate that it is helpful in this virus. It is still unfolding. There are camps that suggest that it could be helpful, but I think right now there are some studies that refute that it is helpful, and that still has not been demonstrated to be something that we're using, for instance, in our emergency department or our ICUs right now. It is something that we are, that still needs to be explored. There still needs to be some greater research on the use of that drug, but right now it has not demonstrated the usefulness something like remdesivir has.
Dr. Jackie, when you're talking about these meds that people are using, are there other meds that are on the way? Dr. Marco, are there other meds that are on the way that you all are beginning to add into your arsenal? Or is the pharmaceutical arsenal pretty thin for this virus?
I think, so the key to this is a novel virus, right? So what a novel virus means is we've never seen this type of virus before. So that's first. So we had to go very quickly to better understand and conduct research, and the research pipeline to get to a vaccine or get to a pill that will help this. We all need to appreciate that you don't just hit a button and the pill comes out. There has to be a lot of research that needs to be done, that it's safe, that it's effective. Who is it effective on? When can you use this drug appropriately? And that requires time. So unfortunately, but now here we are in the middle of this virus, or middle of this response. So what we're doing right now, as far as the nation and the world really, is looking at two different strategies to address the COVID-19 illness. The first are an arsenal of treatment mechanisms. And when I say treatment mechanisms, is different ways to stop the severity of this virus, whether or not it's early in the course or if you're in the ICU and critical. But multiple different therapies are being investigated right now to lessen the death rate, lessen the illness severity as a result of using this pill or using this medication. But that's still evolving. So that's first. The second, and as you hear, is a lot of emphasis on vaccine development. And vaccine development is something that allows us to generate antibodies so that we don't contract this virus again. So those are the two strategies. The thing to know is when you see the headline in the Baltimore Sun that says a vaccine has been developed, that's great news. However, it then needs to be produced in mass quantity. It then needs to be distributed across the world, and then needs to get to your doctor's office so you can get the vaccine. So when you see the headline that says we've got a vaccine, realize there's still a tail to that to be able to get into your arm. There's some assurances that as the vaccine need to be developed, that they need to be safe, they need to be effective. All of those things need to be put in place before you and I have a shot in our arm.
Wow. Woo. Okay.
There are a couple of questions about having windows and screens open. Dr. Marco, if you want to answer those. Someone wants to know, is it okay to have the windows open with screens in their house? Another person wants to know, is it okay, do they need to wear a mask if they have the windows of their car rolled down?
Yeah, it's all about proximity. So if you're someone, it's a difficult question to answer because typically you don't have someone sneezing outside your window of your house and you sitting right next to your window. So let's put that in appreciate the context there. So if your windows are open, this virus is not just spreading through, I think it's fine to keep your windows open and your screens on. That's very low risk. Okay, I'll just say it that way. If you're in your car and you pull up to a Wendy's and you have your windows down and the person who is, you should be pulling up to somewhere, that is a risk because you are in close proximity to that person. So when you're driving your car, if you're at a red light and the guy next to you is not wearing a mask also, and they're within 3 feet of you because you're at a stop sign and they sneeze, a risk. So, just know that this is about lessening your risk. That's what this is all about. And as Dr. D mentioned, the only way it's perfect is to stay isolated, not have any contact. We're never going to get there, but just the important thing to understand is to lessen your risk. That's the key.
Dr. Jackie, can I throw this in? Can you all both talk about what you think, the mask industry has gone into booming. Not since the Lone Ranger have we seen anything like this. What do you recommend for facial covering? And is there a ranking in your mind of what we should wear? Because everybody has a mask. Most people now have about 3, 4. So what do you recommend?
So Dr. Shepard, I'll jump in and then you I'll tag team this one. So this virus spreads by droplets for the most part. Unless you're in the hospital, it can potentially go airborne depending upon specific things we do in the hospital. But let's just say we're out in the public. This virus typically spreads by coughing, sneezing, talking, singing, any of those which produce small droplets that then spread. Those droplets typically go for 6 feet. And that's why there's that 6 feet of distance you need to keep around you. In a wind, yes, it could go more. In a confined space, if you're inside that, that's a risk. That's 1. 2, any covering, cloth, medical mask, any of that lessens the spread of those droplets so they're not spreading as much. So that's what's key, and that's what we're trying to do. We're trying to stop the spread of this virus to different to other people. So if you're wearing a handkerchief, if you're wearing a cloth mask, if you're wearing a medical mask, all of those are helpful and lessen the spread of this virus to another person.
Yeah, and again, Dr. Markles did an excellent job in describing what type of facial covering we should be using. You know, there's some different layers. You know, I've seen 3-layer mask, 2-layer mask, 1-layer mask. The more layers, the better. I guess insulation, if you want to use that word, or protection. You know, so a facial covering is better than no facial covering. So that really is the rule of play there. But you know, most masks have like a kind of like 3-ply. I think that's what they may, 3 layers, something like that. So if you're able to get that type of mask, then, you know, go forward. I see a lot of designer masks now, a lot of bling bling, you know, rhinestones on masks. Yeah, I mean, that's nice. You want to dress it up, you know, but a facial covering is better than no facial covering.
I'd like to jump in also. I know we're getting near end time. I'd like to advocate for kids. Schools apparently aren't going back to October at the earliest, but I think it's important for us to make sure kids have about 5 masks each when school reopens, and they need to be kid-sized masks. I saw on TV where kids were struggling in schools with adult-sized masks. They're useless. We also need to make sure kids practice wearing a mask for long periods of time at home before they actually are in school again. I'd also advocate for us to somehow adopt a school. My daughters are a pre-K teacher, and we were just calculating how many masks that would be for pre-K through 2nd grade. That's 1,500 masks in one school. So we know that resources, especially in Baltimore City, are limited. So we need to make sure these kids have masks. We need to start stocking up on the sanitary wipes that nobody can find. So hopefully by the time they go back to school, they'll have wipes. Kids 4 years old and above can wipe down their spaces. So if they have 2 wipes a day, they can wipe their space down before they start, wipe their space down at the end of the day, and then social distance as best they can. And then on the weekends, wash their little 5 masks and be ready for Monday again. So I just would like to advocate for all folks watching to figure out how you can help kids get their mask and their wipes so that when school starts in October, those schools that really need these masks will have them available.
Dr. Fulton, I wonder if I could just talk one more. If we're talking about masks, by the way, I'm loving that we're having this conversation. But I'm going to tell you, I keep my mask right here. So this is what I see a lot of people do.
Mm-hmm. Mm-hmm.
So the front of the mask is where the virus is.
Mm-hmm.
The front of the mask is where the virus is. So you should only touch a mask by the outside. I don't typically wear these glasses, so apologies. By the outside of the ear loops.
Mm-hmm.
Oh. Should not touch a front of the mask. The front of the mask is where you breathe in, and that virus particle is going to come through that and stop here.
That's right.
So do not, and by the way, when you're exhaling that virus, if you have COVID and you don't know about it, you're getting it on the front of that mask. Then guess what you're doing? You're touching this, then you're touching a doorknob. Mm-hmm. And it is the exact same thing as sneezing. Mm-hmm. So only touch a mask by the sides. And if you're wearing a cloth mask over your face, bring it down from the sides or take it off and then put it in the wash. Do not touch the front of the mask where you're breathing through. A key factor in mask use.
Wow.
So kids need to be taught how to put on a mask, how to take off a mask. You see a lot of folks also with the mask down or below their nose. All the time you see folks. The mask needs to be above the nose and below the chin, if possible. So you need to be covered.
This is not, Dr. Fulton, this is not appropriate.
Mm-hmm. No.
Dr. Fulton, if I could say something, and this is in regards to gloves. You know, a lot of people want to wear gloves and they don't know how to wear or take gloves off. And that actually, you can end up contaminating yourself if you do not know how to put the gloves on and know how to take them off after you have been to a particular site or a store or things like that. I had to learn how to take gloves off when I was in surgery. You heard me mention that earlier. That's where I learned how to be able to do that. I don't have any gloves to demonstrate, but I see people, they wear the gloves and then they start touching everything and they just pull them off like this, but you just contaminated your hands if you don't know how to pull those gloves off correctly. Gloves are nice, but if you don't know how to use them, you're just causing even more concerns. So just wanted to mention that too.
There was also another question about does gargling help kill the virus? And also irrigating your eyes with saline, does that help kill the virus?
Tom's help.
No.
You know, those are all the things that we've heard over the course of this time.
Okay.
Is there a blood type that is more prone to this or one that is less prone to this? Have you all discovered anything in that regard? Because these are tales circulating in our community that certain blood types are more susceptible than another.
Bishop Thomas, I'm going to plead ignorance. I don't know. I think that I might have had an email string that might have been investigating whether or not, but I have not heard Dr. Shepard. I have heard Dr. Right. Fulton. I have not heard anything on this one at all.
That's all I heard. They were investigating that. So
yeah, one thing I wanted, since you're bringing up blood tests, there are two different tests out there. There's the nose test, which tests for the virus. Then there's the blood test, which tests for the antibody. And so there's a little bit of confusion, Bishop Thomas, on, oh, I got a test. And so some folks are getting the blood test for the antibody, which means you were exposed to the virus, developed antibodies which fight the virus. And then you had a test that demonstrated you had the virus at some point previously. Mm-hmm. The viral test in your nose, very uncomfortable, but the right thing to do if you're concerned about it is to test if you have the virus presently.
And children can be tested also, correct? Young children can be tested for the virus.
Yes.
Mm-hmm. But I mean, is there an age that you say we don't test? For their parents watching now, is there an age you would say, no, you don't have to test your child at 6 months or a year or 2 years? Is there an age below which you do not test? You normally don't test children unless they're symptomatic.
We're testing infants. We know we have infants, just neonates who are testing positive. Right. I have a 3-year-old who had the test. So, this is not as Dr. Fulton, I think, started this conversation. This virus knows no age. It's hitting us all. So yes, testing children is necessary.
There's a question about if you wear a face shield, do you still need a mask?
Yes.
Yes.
Okay. Listen, some of us gonna have on mask, face shield, and I put my order in for a helmet. I'm gonna have an oxygen helmet attached to my shoulders with the oxygen coming up into it, and I'm gonna have a mask on, a double mask on under that, and a shield over top of that.
Had that on our last
coming down to the end.
Are those masks that have the vents and filters effective?
So as far as like about N95 masks?
No. They're those masks that have the little vents.
Want to see one? I got some.
I'm sure.
Okay.
They're the cloth masks that you put filters in. Then they're the big masks that come with filters and all.
And they are also the ones that have the vents on the side. From what I heard is that the ones that have the vent on the side are counterproductive because you're venting. So I'm not sure though.
Yeah, I think I had heard that, Dr. Fulton, and I had also heard that, to Dr. Shepard's point, you can put a barrier between that vent and between your mouth and the vent that stops. It's like a layer that stops it from off gassing or that spreading. So I think each mask is a little bit different on that. But you made a good point that if you're allowing it to shed out, then you're not protecting someone else. So that's a concern. For the ones that have the they're almost like pappers that have seals and filters on the side.
Mm-hmm.
They allow for both entry and exit. So as far as I'm aware, they're protective, but you need to look at each mask to make sure of it. Because if you're able to inhale and protect yourself, but exhale without it being filtered, you are a risk to other people standing around you. That's the bottom line. Each mask is different. Look at it to see how it operates.
There's a question here about Tylenol and vitamin D. Well, do they help prevent the virus? I also had a question here about Motrin. Should you use Motrin or Tylenol for fever if you have COVID? So Dr. Marco or Dr. Shepherd? I know the Tylenol and vitamin D help prevent the virus.
Yeah, Tylenol does not preventive.
Right.
It's for symptoms. So if you have a fever for anything, just a common cold, you'll take, maybe muscle aches, taking Tylenol helps control the symptoms. That will be first. So not protective, but just helps you control symptoms. I'm sorry, what was the other question?
Vitamin D.
Vitamin D. And again, vitamin D is not preventing you from catching COVID-19.
Okay, and whether or not, at one point in time, they were telling folks not to take Motrin if you have fever with COVID. Is that still something that's being recommended?
I haven't heard that change at all.
Okay.
No.
Okay. Someone's asking, should we get the pneumonia vaccine if we're due for it? Yes.
100%, absolutely.
Yes. Then there's a question here. Can you tell us something about herd immunity? Wouldn't it be better if we all just had it? Or if we
I
all
don't want it.
COVID-19.
This is a
complicated.
Yeah. So herd immunity is what you try to achieve when a population has protection against a virus. And to achieve that, it requires a certain level of infection across a group. Right. And you typically would want to achieve that from getting a virus in your arm, a vaccine, so that you didn't come down with the virus itself and potentially get sick from the virus. To achieve herd immunity, there is a risk that we would have a lot of people exposed to a live virus. And if we're exposed to a live virus, then a lot of people would become sick. And then the healthcare system would not be able to respond effectively to the overwhelming people who are ill. And that would be a significant challenge. Right now, it is not the strategy we're employing. We're trying to lower the risk until we get a vaccine so that our healthcare systems continue to operate and treat these people, but they're not treat these people with this illness, but they're not overwhelmed by people presenting to the hospitals because of this illness.
Do you advise voting in person? If you wear a mask and socially distance, should it be okay?
If you can stand for 5 hours.
Yeah. Dr. Fulton, you could probably answer this one better than I can.
I would say get your absentee ballot.
Can I add?
Just personally, I just think that first of all, most of the folks who man the polls are seniors.
True.
Apparently, we need 3,000 of them. So as Bishop's saying, the lines are going to be long because apparently they're having great difficulty getting people to volunteer to man the polls. So that puts everyone at risk. You put the seniors who are there at risk because they are basically individually seeing more folks come up to them. And you're putting yourself at risk. You're standing in lines for long periods of time. So I'm just saying.
Can I join you on that, Jackie? Can I join you? This is a risk you don't have to take.
Correct.
Right.
I mean, they're offering an alternative. So this is whatever it is you want to accomplish, you can still accomplish another way with zero risk. The doctors have taken time to make us aware of the variety of risk and the gradation of risk. But this is an activity for which there is an absolute alternative. And we don't have to put ourselves or anyone else at risk or create an environment for a super spread. I would say, and I'm the quack on the panel. I would say, get yourself a mail-in ballot and send that thing on in.
Which means that you need to get your ballot now, because you only have an application for your ballot right now. You have to actually request a ballot. So.
And we're starting to help people. I think it's either starting next Sunday or so, or sometime real soon. The church is starting its move toward the election. And part of what it's doing is helping people register and helping people get all of the stuff that they need. It's a real quick process to get the absentee ballot. It's not laborious, and you can get it done and get it done quick. And you'll be, and we have people who will help you if you can.
Dr. Shepard, you had said that you're the board chair for the Black Mental Health Alliance.
Yes, ma'am.
What sort of services do they offer?
So Black Mental Health Alliance is a not-for-profit that provides consultation, education. We do not provide care services. So we provide a litany of action items where we are doing symposiums. We're doing this series called Black to Basics. So we're focusing in on Black women, Black men, and how they're being affected by the COVID-19 pandemic. We started out the series on the last Monday in March with the title called When America Catches a Cold, the Black Community Gets Pneumonia. And so we have just been really hitting hard and educating our people about the stigma of mental health and being able to provide those services for our people. Also, one of the biggest things that we're known for is a referral base for being able to identify clinicians and psychiatrists of color within our area that we can refer you to. So again, we can be a referral resource. We can be an education resource, a consultation resource. We don't do any direct care services. And those are just some of the things that we do through the Black Mental Health Alliance.
Do you have a phone number or a website?
Yes. I will put that in the chat,
Okay.
if that will work.
Dr. Jackie, this has been awesome tonight. I mean, it has been, I think we've covered many of the areas that persons really wanted to deal with. And I mean, and this is going to live online. Reverend Joshua, I think we're correct there. This will be living on Facebook, and it will also live on our YouTube channel. So persons can come, and I would encourage you to tell your friends, everybody, to come on, listen, watch it through, to listen to the different question areas so that they can begin to get some guidance in the things they're going to do. Jackie, you have guided us good. You have carried the mail. I didn't know we would have so many questions that were just bouncing through, but you have led us through them and helped us to navigate this tricky area. I think there's some big takeaways. For me, there's the takeaway of understanding everything comes with a risk. And that though we cannot live our lives in total isolation, we can work to minimize the risk that we put to ourselves and to others and to those that are under our care. The second takeaway for me is, and I saw it tonight, there are far more questions about mental health tonight than there were the last time, because the mental health issues are beginning to rise. And the third takeaway for me is this: there are people out here who want to help, who want to give us good advice so that we can all make it safely through. And so I'm encouraged. Dr. Jackie?
Thank you. Thank you, everyone. And thanks, folks, for participating.
We love it. Thank you, everybody. We hope you have a great night, and we'll see you in church on Sunday. Be sure to go to
Okay,
YouTube
Dr.
and watch it.
Marco.
Yes, Dr. Marco, you got it right now. I'm going to have to do my mask different because I'll be grabbing all over the front of it. But I'll do different from now on.
All right.
Dr. Shepard, thank you again.
Thank you, Bishop Thomas. Thank you, Dr. Fulton. Thank you, Dr. Marco.
Thank you.
And Monday night is our educators for our town hall. For all educators everywhere, be on with us Monday night. We have about 700-800 people on here tonight. And so God is just blessing in a major way so we can get a message out. Thank you all. Good night.